Welcome, everyone. I'm just going to give it one more minute while people are jumping on. Well, good afternoon, everyone, and welcome to our webinar, The End of Surprise Medical Bills, Everything Tennesseans Should Know. We have a terrific lineup of speakers for today's session. This webinar is brought to you by the Tennessee Healthcare Campaign. My name is Judy Reutman, and I'm the Executive Director. Tennessee Healthcare Campaign is a nonprofit, nonpartisan organization working for over 30 years to promote healthcare justice in Tennessee. We believe that all people in Tennessee deserve access to affordable, equitable, quality healthcare. We advocate for programs and policies that improve the health and well-being of Tennesseans. Our interest and advocacy regarding surprise medical bills goes back several years. We were thrilled when Senator Lamar Alexander was able to pass the No Surprises Act with bipartisan support in December 2020. And we are closely following the companion bill that's currently in discussion by our state legislature. Today's actually a historic day. 2 years ago today, the World Health Organization declared COVID-19 a global epidemic. If we have learned anything in the last 2 years, it's that we are all in this together and we are all essential. Disparate access to care in Tennessee is having tragic consequences in rural areas and for communities of color. The Tennessee Healthcare Campaign is responding to the crisis with a renewed push for Medicaid expansion. We also broadened our rural health equity work to include access to vaccines for underserved communities of color. In addition, we launched Enroll All Tennessee, a nonprofit insurance agency helping people get the best coverage for the lowest price with TennCare, healthcare.gov, and community resources. And I am thrilled to report that our first bilingual family services specialist starts work next week. Our organization's success is due to the incredible commitment of time, talent, and resources by our many volunteers. And I want to give a special shout out to the members of Tennessee Healthcare Campaign's Education and Conference Committee who put together today's webinar, and especially to Jacqueline Dalton, the committee chair. If you are new to Tennessee Healthcare Campaign, I urge you to check out our website and sign up to get involved. To get us started on today's webinar, I'd like to introduce you to today's moderator. After serving as a catastrophe team leader for Allstate Corporation, where she worked for 42 years, Joyce Washington retired and immediately turned her energy towards social justice advocacy. We were fortunate to have her join the Board of Tennessee Healthcare Campaign this year. She grew up in Northwest Tennessee and returned to the area in 2007. Joyce is also chairperson of the Martin Housing Authority. She's a member of the Delta Sigma Theta sorority and serves as a recording secretary. She has a master's degree in business administration and a master's degree in strategic communication. She is a certified racial justice facilitator, and most recently, she's been assisting with the weekly county tornado recovery team. Joyce Washington, take it away.
Thank you so much. Good afternoon, everyone. And we appreciate you taking your lunch hour, maybe, to join us today. We're going to spend a little time just learning about the end of surprise medical billing. We have two presentations or discussions because we want this to be conversational. And then we'll move to a Q&A where our panelists will answer any questions that you put forth. As things are quite fluid and moving very fast for all of us with this effort, but it's critical that consumers and providers understand the benefits and the challenges. The most recent development was that in late February, the U.S. District Court of East Texas, in a case involving the the Texas Medical Association versus the United States Department of Health and Human Services, actually struck down some critical pieces of the federal legislation. The set-aside was part of the independent dispute resolution process that was really intended to help keep health costs down. So with that, you should also keep in mind that next Tuesday, the 15th, the state version will come before the Tennessee House. So, to keep things moving, and because we only have an hour, I would like to present our first panelist. It is Cheryl Fish-Parsham. She's the Director of Access Initiatives for Families USA. Her job there, she focuses on policies that would improve access to coverage and care, including those related to oral health and behavioral health services. She serves on the advisory committee to the DC Department of Insurance and the DC Healthcare Ombudsman. Previously, Cheryl served as Families USA Assistant Director of Health Policy. Cheryl, won't you please join us and share all of your great information?
Thank you, and thanks a lot to Tennessee for all the work that you've done to make this act even happen. I really appreciate all of your hard work. And I think you have my slides. I'm gonna, there we go. And you can just move on to the next slide, please. So I'm going to talk a little bit about the different provisions of the law and also talk about where enforcement and oversight and outreach to consumers are needed. And so here are the kind of three provisions of the law. One is no surprise billing for emergency care and for certain in-network hospital charges. Patients who are uninsured or self-pay have to get good faith estimates of the charges that they'll face. And there's the payment amount for how will providers who are out of network be paid and what amount, which is the court case that you just talked about. So in all of that, there are outreach needs and enforcement help needed. And so we'll talk about those at the end. So next slide, please. Next slide, please. There we go. So this law is really important because almost 20% of emergency department visits have resulted in surprise medical bills before the law was enacted. And an average surprise bill could be $600, but it could also be more than $100,000. And a whole lot of health plan spending was attributed to surprise bills. So next slide. So here are the provisions of the law that apply to emergency services and to some hospital and ambulatory surgical centers. So effective now, this law applies to consumers who are in job-based and individual private insurance. So it does not apply to Medicaid and Medicare. They have their own protections, many of which are similar, but they're not the same protections that we're going to talk about right now. So the first provision of the law bans out-of-network cost sharing for emergency services, including air ambulances. And that means if you go to a hospital or a freestanding emergency department or an urgent care service center that is licensed by the state to provide emergency services, that facility must provide you screening and stabilizing services if you believe you're in a medical emergency. And the providers in that facility and the facility itself cannot bill you an out-of-network rate. So you may still have cost sharing under your plan, but you won't be facing an out-of-network cost sharing rate. The second provision of the law is regarding out-of-network charges for some providers who work at an in-network hospital or an ambulatory surgical center. And before the law was enacted, it was a common occurrence that people went to a hospital and they picked a hospital where their doctor was in network, where the hospital was in network, but they still got bills from anesthesiologists that were out of network. So this stops that practice. It requires those kinds of providers to accept the in-network charges, and it requires any healthcare providers and facilities that you choose to see to provide a notice about the possible charges of going out of network and your option to go in network instead. It's actually a waiver form about your rights, and you should probably not sign it unless for some reason you really wanted to see an out-of-network provider in an in-network facility. Next slide, please. So here are some of the implementation issues that some states are caring about. And I think Tennessee may be in this, working on this first issue. Emergency services under the rule can be any service that is issued in a freestanding emergency department that's licensed by the state to provide emergency care. So some states are grappling with the question about, well, what about behavioral health services that might be delivered in a different kind of facility, but they are definitely to work on an emergency, and what will happen with mobile crisis centers and where people are taken after a crisis. So Washington State is one bill that has a bill to clarify that behavioral health crisis services do count as an emergency, and that's something that states are looking at. Another question is a service your emergency protections end when it is safe to transfer you to another facility, you're stable enough and you're able to give informed consent. And so that's where sort of advocacy is needed to kind of watch out for that and make sure that people really are knowing their rights and giving an informed consent. There's a form to sign, but whether people are in a condition to sign it, that's something for patient advocates to watch out for. Another provision to watch out for is that what happens if you're surprise billed nonetheless, well, you can appeal your plan's decision not to cover emergency care by an out-of-network provider. And you have to make sure that consumers actually know that they can appeal if they get one of these bills and that it's working, and that their plan is understanding that they're appealing something that's covered by the law. And then the last thing is that there's sort of a complicated enforcement mechanism where some complaints would go through the state Department of Insurance, some would go through federal Department of Labor or another place. There's a federal hotline that's been established to help make sure consumers get to the right place. In some states, the state is trying to make sure that even if a consumer complains to the state about a federally regulated plan, it quickly gets transferred. So that's another implementation issue. Next slide, please. So the good faith estimate is the next provision, and it says that if you are an uninsured or self-pay consumers, you have a right to an estimate of what your charges are going to be. In fact, the provider has to reach out and offer you that estimate. If there are changes in your planned care, you get a new estimate. And if the final price is more than $400 more than the estimated charge, you can dispute that. And by next year, if there's more than one provider involved, whoever's scheduling the service has to contact all the co-providers and get an estimate for you from each of those providers. Next slide, please. So some implementations about that are, is this actually happening? We'd love to know whether patients that you see or yourselves are getting good faith estimates and understanding the notices. The rules actually say that if a facility has an obligation to provide free and discounted care, because it's a nonprofit hospital, for example, that has to be factored into the good faith estimate. We're really interested in hearing how that's working and whether patients are getting screened for financial assistance that they might be eligible for. Also, if the patient disputes the final price, we want to make sure that debt collection and any interest get paused. So that's the next slide, please. So here's the tricky issue about, okay, so consumers have all these protections, but what if they go to see an out-of-network provider? They're not going to be held responsible, but how much is that out-of-network provider going to be paid? And that all is subject to an independent dispute resolution system. And each party offers a payment amount, and this resolver looks at it and decides who should be paid what. And they have to look at the median and in-network rate, the experience of the provider, and any additional information, but they can't look at the Medicaid rate or the Medicare rate to set appropriate rates. And the rule says that they have to use the median and in-network rate unless there's credible information that in-network rate, median network rate isn't appropriate. And that's what has been challenged in court cases and was just struck down in Texas. So Texas has vacated the presumption that the independent dispute resolution should rely on the qualifying payment amount. And that's being appealed, but right now it has been vacated for now. And there are several other court cases pending in other states that you can see below. And so I think the most important message for consumers is that none of this affects them directly. We're concerned about it because it will affect the price of healthcare, but it doesn't affect their protections under the No Surprises Act. So next slide, please. So that's the message to consumers. None of these legal challenges stop consumers from using the law's protections. Consumers shouldn't be surprise billed for emergency services or by certain providers in network hospitals. So next slide, please. So here are the overall needs for everybody to help spread the word. One is just to provide simple messages in common scenarios about how to complain, provide them in multiple languages, explain rights, that these are rights for private insurance, but there are similar rights in Medicare and Medicaid. So just be clear about which rights you're talking about. And CMS has a good website now, and they're developing more and more outreach materials. I'll drop that link in the chat. Kaiser Family Foundation has a terrific video for consumers, and I'll drop that link in the chat too. Next slide. So then the second sort of implementation issue that I think we'll hear about in a minute is enforcement. Are federal and state enforcement agencies well coordinated? Are the helplines working? What's the oversight with respect to providers? And on the CMS side, I know CMS is holding a number of listening sessions to keep hearing what's working and what isn't. So, you know, I know somebody called the helpline and didn't get information in their language. We reported that to CMS. CMS is really actively taking any complaints like that to make sure that things work well. Next slide, please. And then the price is the next overall issue, and we've already talked about that we want to make sure that that all the prices end up reasonable at the end of all of these lawsuits. Some of the lawsuits are using amicus briefs by consumers. And so if you wanted to get involved in that effort, please reach out and I can tell you more. And that might be it, but oh yeah. Oh, how can you keep the No Surprises Act strong? We really want you to help get out the word to consumers. We'd love to hear any issues you're facing on the ground with the implementation or enforcement or gaps. We can definitely help you tell the administration about it. Storytelling is important. We'd love to hear both what's working and what's not. The experience of consumers is what keeps lawmakers enacting laws like this. And reporter outreach, please keep talking to reporters about this law so that they keep telling the public that the law exists. And I think that wraps me up. And we have a whole team at Families USA that's working on this, and you know, feel free to reach out to me or any one of us. Thank you very much.
Thank you, Cheryl. A lot of excellent information in there. I was trying to take good notes, but I don't think I was very successful because there was such good information. As you may have seen from Judy, this is being recorded and we are going to put it on our website. So if you missed anything, you'll be able to go back and play this video and then capture your information. We do have a couple of questions that have been put into the chat. Jacqueline, should we hold these till the end?
We have time to answer them now. A couple of questions.
Okay. Amanda and Cheryl, I think this would be a great story, a personal story. Amanda has had a mildly abnormal blood test. She went to see her PCP, referred her to an in-network specialist. She paid a copay, which she expected. He wanted to do more tests, and then she gets a bill for $3,000. She's insured on her husband's commercial workplace insurance. They said that while the specialist office was in network, oh my goodness, the lab was considered hospital services. So would you like to address that, or you have suggestions for her?
Well, I guess one question is, did this happen before or after January 1st? January 1st is the effective date of the law. If it happened after January 1st, that sounds at first glance like that should be covered and you should have gotten the good faith estimate. Oh, wait a minute. So I guess it depends on the setting. If you were a self-pay patient, I'm sorry. So if this was in a hospital setting or a healthcare facility setting, it sounds like it should be covered. I think I probably need to write to you offline and make sure I'm processing it all. It's it's a lot to process in one bite, but I would be happy to look at this further and then answer you offline if that would work for you.
Amanda, could you, at least in the chat, let us know if this happened in 2022 or prior to 2022?
2022.
Oh, so this is recent.
Yes, ma'am.
So there may be some portion of the legislation that might be able to help you. And Cheryl has indicated if you will drop your email, she will try and work with you through that. Could you do that for us?
Sure, no problem.
Thank you so much. I'm confident that Cheryl will be able to at least give you some insight. And with that, we will move on to our next presenter. Vicki Trice, who works for the Department of Consumer and Insurance, isn't able to be with us, but her colleagues, Jennifer Rancharan, I hope I didn't butcher that too bad, Jennifer, Scott McNally, and Stephanie Cope are all here, and we will hear from Jennifer, but Scott and Stephanie will be here to help answer any particular questions. Thank you, Jennifer. Please proceed.
Hello, thank you all so much for having us. Yes, unfortunately, Vicki Trice was unable to make it today, but Scott and Stephanie are going to help me out here answering any questions and adding something if I forgot to mention anything. So I don't want to be redundant on anything that Cheryl presented. So I want to try to keep this all new and fresh information. So I do outreach for the Tennessee Department of Commerce and Insurance. So we're the Department of Insurance. We regulate anybody selling insurance in the state of Tennessee. And so, you know, basically our department's whole goal is to make sure that we are having balance. We're being fair to the insurance industry as well as being fair to the consumers. And, you know, some of those go hand in hand. For example, we have to have a good insurance industry, insurance marketplace, so that they can pay the claims for the consumers. One thing that I really wish that Vicki was here is her area is the consumer insurance services section. And so her area covers anybody who files a complaint about an insurance agent, insurance company, public adjuster, etc. They can file complaints with her team, and then her team will go through the complaint process. And so they will act as mediators between the consumer and the insurance company. Last year, they were able to get over $8 million back in the hands of Tennesseans through these efforts. And in the year before, it was over $10 million. So this is definitely something we encourage Tennesseans to understand and to know that we are here for them if they ever have an issue with their insurance company. So this applies to health insurance as well as auto, life, any line of insurance in Tennessee. And one thing I wanted to kind of piggyback on is Cheryl said that, you know, it does get really complicated with health insurance because some of it's federally regulated, some of it is state regulated. But we encourage in Tennessee, anybody who has an issue with their insurance company can just call our department and we can transfer it over to the right people. If it is federally regulated, then our team knows who to contact, who to send them to. And of course, if it is state regulated, then we can help out there. As far as the No Surprises Act, a couple of things that I wanted to mention in addition to the things that Cheryl had said are one thing that the law requires is for insurance companies to keep their provider directories up to date, which I think is really important because we have had quite a few complaints about how somebody looked at the directory, went to see that provider, and then later found out that that provider was not in network and did not accept their insurance. And so this really adds protection for those people who have those situations. Anybody who goes to see a provider who is on the directory of in-network providers and then gets billed an out-of-network rate, the insurance company has to give them do the in-network rate for them as well, because it is the insurance company's responsibility to have those directories up to date. So I think that is really wonderful news. They have to charge in-network co-pays, co-insurance deductibles, et cetera. I think that's wonderful. And then another thing is, obviously they have the independent dispute that Cheryl had talked about in this law. But just again, we have further protection for Tennesseans because they can file a complaint, even if they have an appeal or going through a different process. We encourage people to file a complaint with us. It's very easy. There's a link on our website, which I will provide links that I talk about in the chat, but there's a link on our website that goes to the online complaint form. You fill it out online, or for people who would rather do it in print, you can print it off, fill out the form, and then mail it into our office, or even bring it into our office. Once you file that complaint form, then our team will contact you within 48 hours and we'll start the process. So they're going to be in touch with that insurance company. They're going to look at the policy. They're going to see what's going on, make sure that the company is acting in accordance to the law and to the policy, and sometimes come to a resolution. And even if, one thing I wanted to say is that surprise billing has been an issue for a long time. And so I think that we were very happy to see the No Surprises Act, because before, there were some things that we could do, but it really wasn't as much. So I wanted to say that because even if it seems impossible, file a complaint, we'll look at it and we can try to talk to the insurance company and try to see if there's anything that we can do, any sort of resolution we can come to. Because sometimes we're able to work up something for the consumer, especially if it's an exorbitant amount and maybe the consumer is going through hard times. So even if you don't think we can do anything, just try and we'll see what we can do. All right. Yeah, so let me just talk a little bit more about the complaint process, because Cheryl did touch a lot about the No Surprises Act. So we contact you within 48 hours, and then the company, we send something to the insurance company, and they have to respond to us within 30 days. If the insurance company does not respond by 30 days, then they have to pay $100 a day until they do respond. So typically they do respond within that month. So that is really good news. And we will always be in touch with you, the consumer. We're always, our team will always be working on that case until it gets completed. And usually it's completed within 2 or 3 months. Sometimes it takes a very long time, but that is on the rarer side of things. We also, just to touch on our outreach as far as the No Surprises Act, we have a lot of information on our website. We have sent out a press release about the No Surprises Act. We have sent out a bulletin to the insurers in Tennessee, the insurance companies and insurance industry in Tennessee. We also have a video on our YouTube page, which I think can also be found on our website, but I'd have to check again. But we have a YouTube video that talks about the No Surprises Act as well. Okay, Stephanie and Scott, is there anything that you would like to add that I have not spoken about?
Hey, Jennifer, I don't think I have anything to add. I think you did a good job covering it, as did first speaker Cheryl, was it? I know that was a great breakdown of the law. So not much to add, but happy to contribute on the panel as questions come up if you need me to.
Yeah, I would just reiterate exactly what Scott said. I think Jennifer and Cheryl did an excellent job breaking down the bill and how it will apply to consumers. And then again, if you do get that residual bill, what to do, come to us. We'll see what we can do. And I will say, I think one thing that we have found throughout the implementation of this law is the difference between a surprise bill and a balance bill. I think a lot of times people think those are synonyms and they're interchangeable when they're actually not. A surprise bill is when you receive a bill that you should not have gotten, versus a balance bill is a typical co-insurance that maybe you weren't expecting. So those are two separate entities. We're happy to answer any questions on that as well.
Yeah, that's exactly right. Balance bill. You know, in some situations, somebody might want to see a provider that is out of network, or they might, have a reason where they want to go to a facility that is on network or see a provider out of network. And in those cases, they know what they're doing. They know that they are seeing this, and they know the price is going to be more. And so that is a consenting agreement. So that is definitely different from the surprise bill, when you think that you're covered and you're not. So we are happy to answer any questions. We're leaving it up in your hands, Joyce.
Well, thank you, because we have quite a few here in the chat. And the first one is, and I know the answer is yes, but I don't have the number. Does the Tennessee Department have a 800 number?
Yes, I will put that in the chat right now. Actually, I'll put our number and our website.
Thank you. Another question that we had is there a time limit as to how far back the department can go to assist a consumer?
I don't think so, but of course, as far as the No Surprises Act is applicable, that applies January 1st.
Of this year,
Of
correct?
this year, yes. So, unfortunately, if there was a situation with the surprise billing in 2021, this law does not apply to that. But I don't believe that there is a limitation on how far back we can help.
Okay, so in terms of the legislation, it would have to be something that occurred in 2022. If it's
Right.
just maybe a surprise bill that came in 2021, they could still file a complaint, but not necessarily have the protections under the legislation, correct?
Exactly.
Okay, thank you for that. Someone wanted to know if the department had any suggestions for Amanda, who is a consumer and who shared her personal story. How would
Yes,
you suggest
absolutely.
she proceed? As I understood, Jennifer, you indicated that they could have a concern that may be with a dispute resolution entity, but that doesn't preclude people from filing with the department.
Absolutely. Yes, you can file a complaint. People file complaints for all kinds of different reasons, even if they don't agree on a settlement, for example, with like auto insurance or homeowners insurance. Yes, file a complaint, and then our team of investigators, they know what they're doing and they know exactly what to look for, and they will know how to help you out. They'll talk with the insurance company, see if there's anything that they can do. And I'm going to actually send a direct link to our online complaint form, which can be found on the website that I just sent over, but this is just a direct link so that you guys have easier access to it. There you go.
Okay, thank you. Does the No Surprise Act protect people who have insurance from the Tennessee Farm Bureau?
Yes. Yeah. Yep. Anybody who sells health insurance in Tennessee. Obviously, Medicare, Medicaid is its own thing. There's a lot of great information on the CMS website. Really is wonderful, and I encourage you all to look at it. But yeah, anybody who sells insurance, health insurance in the state of Tennessee.
Okay, here's a question. Will the new legislation provide intervention at the point where hospitals and outpatient clinics act as agents of out-of-plan contractors? Informed consent requires direct plain language statements of cost and liabilities.
Yeah, Scott, is there anything that you would like to add to that, or Stephanie?
Sure. So, and I may have, misinterpreted the question. So if the question is whether or not the No Surprises Act, is enforceable sort of at the provider level, my interpretation that the answer would be yes. Now that wouldn't be a commerce and insurance, enforcement. So there are many provisions in the No Surprises Act on providers that maybe are not, don't come up as much in the balanced billing context, but they have all sorts of reporting requirements they have to do now, notification, things of that nature. So there are other entities, I think, to enforce providers' standing rules. So if the question is, how are provider activities regulated in terms of sending me a bill? I mean, I do think that the No Surprises Act would touch on that, especially if we're speaking about out of network providers based in network facilities, which is where I think, the vast majority of what we understand to be surprise bills originate. They're certainly under the legislation, but I don't think that we're necessarily the entity that enforces those requirements.
And CMS, I believe, is supposed to have obtained from every state how they are enforcing those requirements. So in some cases, it would be the Attorney General, but if in doubt and you're trying to deal with a problem like that, I would suggest going to the CMS help desk.
Okay, we have one additional question from Tony that we'd like to take. And then I'd like to ask Cheryl if she has any additional comments. Tony would like to know if a person gets a bill from a out-of-network ground ambulance service that is not covered by the NSA, No Surprise Act, can the Tennessee Department of Commerce and Insurance help them resolve that bill?
Maybe. I definitely encourage you to try, though. Definitely file a complaint, and our team can look over the policy and talk with the insurance company and see if there is a resolution that can be made. I'm not going to say yes, we can definitely make something happen, because it really just depends. But definitely file a complaint and we will see what we can do.
And I will add
Thank
off
you.
of that. I work for the Department of Commerce and Insurance. And what we did see with the No Surprises Act, just for some background, they couldn't get any ground ambulance language into the legislation. They did address some air ambulance, but because ground ambulance varies state to state, they just couldn't create that blanket law across the country. So in the legislation, they did direct HHS to do a study on the use of ground ambulance and the cost. So that may be something we see happen in the future. But as far as helping resolve bills, similar to any complaint process or any complaint that you have with any line of insurance business, we are very happy to help, like Jennifer mentioned. But I just wanted to provide some of that background there.
Thank you. And I have this for you, Cheryl. How are other states handling this whole ground ambulance service piece? Yeah, take that one and then I'll follow up with another one around that.
I haven't done any state by state analysis of how states are dealing with ground ambulance. I know in my city state of the District of Columbia, you can vote for DC statehood while you're at it, but in DC, they have dealt with it through a contract with the fire and ambulance service, which runs most of the ground ambulance in DC. But
okay, that takes care of my follow-up. So I suppose to advocate for that, and this would go probably to you, Scott, since you're the legislative person, how can we as consumers and advocates help get some language into at least the Tennessee bill. While air ambulances are vital and they are used, because we're kind of rural, we use more ground ambulances. So what would you recommend that we do? How can we help you? Help us get that into the Tennessee version.
Sure. So I do think that a measure that would address the billing practices of a ground ambulance service is within the General Assembly's purview. So I don't think it's something they can address, and they certainly could. It is not something that the administration has advocated for this session. Legislative agendas for next session start formulating in the fall. So, I think we're always happy to hear out, instances. And I think we would recognize, as anyone would, that this is obviously an area that the federal bill didn't address. But, to the extent that you all have legislative partners, you can certainly work with them to pursue a solution. And in terms of the bill, I've not seen any additional amendments or anything that would take up ground ambulance for what's before them in committee this week. So I've heard a couple of times people, commenting that there's a state bill before the General Assembly. There is. So the Senate has already passed their version, and the House is set to take it up Tuesday afternoon. Now what I've seen so far is that they would essentially just be adopting what's in the federal law, so that gap would still be there. But yeah, the General Assembly could definitely address it.
Okay, thank you.
Just to piggyback off that, this goes for ground ambulance or whatever other issues you all may face as a consumer, provider, insurance company, what have you. Please feel free to reach out to us on any of these topics and bring them to our attention. We always have open ears, open doors. We want to know what concerns are at the top of your list and how we can help. So please never hesitate to reach out on any of this.
Okay, thank you. Scott or Stephanie, can you explain who is providing the oversight for the independent dispute resolution entities and of the notice of responsibilities by hospitals and other providers?
Well, the IDRs so far, I think, have all been federal that have applied. I think I hear that right. So, we're a part of the National Association of Insurance Commissioners. I'm on a call once a week that sort of reviews these type of things. And when I've heard IDRs come up, I think they've all been nationwide that have applied. So that oversight so far is at the federal level.
And those are actually all on cms.gov. You can actually look at the IDRs, how much their fee is for one case. If you have multiple cases, the grouped fee there. So that is all broken down on cms.gov for the federal IDR process.
Okay.
That's not a fee the consumer pays. That's the No Surprises Act was set up in a loser pays format. So whoever does not prevail in the dispute would pay the fee to the IDR.
Okay, thank you. Jacqueline, did I miss any of the question? Here's one. Are we going to do training of providers, particularly hospitals and clinic business offices? I've had a discussion with some business offices that deny such protections exist.
I am not aware of any training for providers, but once again, the biggest way that we can help is consumers need to file complaints. Really, that's how these sort of situations come to our attention, is through complaints. Even if, if insurance agents are acting not in the best way, the best way for us to learn about that is through complaints. So anytime that your provider or anyone you're dealing with in a healthcare setting is giving you an issue when it comes to insurance, then please file a complaint with our office and we'll see what's going on and try to help out.
Okay, thank you. I thought this was a good one. This is something that came in earlier. If I'm a Tennessean that thinks I'm having a heart attack and visit the ER, but later find out that the issue was not life-threatening, would I still qualify for the protections provided by the No Surprise Billing Act?
Yes, you
Yes.
still qualify, yes. It's whether if you have reason to believe that you have a medical emergency, you're covered.
Thank you. Are there any others?
Yeah, Joyce, I think, one question we also had is wondering if services are provided, emergency services are provided in a setting that's alternative to the clinical setting. So somewhere different than a hospital. Do those services still apply under this rule?
That's the one where you have to, it defers to how the facility is licensed under state law. If it's licensed under state law to provide emergency services, then it's covered. So that's where you would want to make sure that your state law is comprehensive about places that could be providing the services.
So it's about 1. So I think maybe we will open the floor for any final comments from our panelists or any final comments from any of our participants today.
I see in the
We have
chat, Scott, can you provide the Tennessee bill
bill numbers.
numbers?
Sure. If you're asking for the state surprise billing, that is Senate Bill 0001, House Bill 0002.
Thank you, Scott. Any comments, Jennifer or Cheryl? Was that you?
Yeah, I
Yeah,
think Cheryl was trying to speak.
I just wanted to thank you for the opportunity for being here. You work on these policies for a long time, and it's really, we're really grateful to hear that they finally met the road and that consumers are beginning to learn about them, and your questions really help us to think through what's the next step and what else do we need to do here. So I really appreciate the opportunity. Thank you so much.
We certainly appreciate you joining us today. I am dropping into the chat box. This is the Tennessee Healthcare Campaign's website, but it is the page for the impact of surprise medical billing. So we would ask that you, we also have a QR code that you can use. So, Judy, do you have any further comments, or Scott or Jennifer or Stephanie?
I would have one real quick. I think it's important to keep in mind that this is a very large measure, and I think implementation is going to take a while to smooth out. So, CMS, through their CIO office, has issued letters to all but 7 states and territories on the shared enforcement of the No Surprises Act, and we are one of the 7. So we are still waiting on guidance ourselves from the federal government about how exactly this is going to be enforced. So I think that, it's laudable. It's a great thing, but I think it's going to take a while for it to really, start functioning as intended.
Thank you for that. It will be a heavy lift, I'm sure. So if there are no, Jacqueline has shared the main website for Tennessee Healthcare. We'd love to have you join us. So if you could check out the main page, but also the page that I shared that will take you directly to the No Surprise healthcare bill page. There are videos with actual stories of people who have had their lives impacted by this type of billing. So I don't have anything else. Judy or Jacqueline, do you have closing remarks for us?
I want to thank the presenters for a really informative discussion today, and thank all the participants for attending, and encourage you to visit our website. There's an action alert there. As Joyce said, the state House of Representatives is taking up this issue next week. So if you want to send those people an action alert, easy to do through our website. And please tell us your stories. We want to hear what's going on with this bill, and keep in touch. Thank you very much for joining us.
Jacqueline, do you have any closing
Oh,
remarks?
I was waving just to say thank you for your time, and everyone have a great Friday and a great weekend. Please let us know your thoughts on our evaluation. It's the link is in the chat. So thank you all so much. Have a great Friday. Bye.
Bye.